Today we're going to do a prenatal tape job on Ashley, which is called a baby belt. This is going to make it a lot more comfortable for her to roll over in bed, sit, stand. It's very comfortable. So we're going to tack this down below the belly button on her right side, adding just a tiny bit of stretch as she turns, lifting her arm. And then we're going to put this last bit right up underneath and across her back. Perfect. We just want to rub that to get the adhesive going. And the next piece of tape, which by the way, you can just tear that corner to get it started. We're going to tack right under this side. Again, just a little bit of a tiny bit of stretch. And go ahead and rotate toward the window. And we're going to pull that up and under the other side. Try to make these sides as even as you can. All right, and turn this way. So Ashley's 32 weeks. Right after about the 30-week mark, you can leave the tape job just like this earlier in pregnancy. But as you get a little later, it can be more comfortable to have a piece of tape coming up the top of the belly as well. So we're going to tack this right up around the belly button. And you want to start the tape always on skin. So you want to try not to overlap the other piece of tape when you're starting it. And right there. And you're just going to sort of rub that to help it adhere. And that's the baby belt for pregnancy.